Hello and welcome to Southwest. I'm Sumit Jha. LASA drugs, look alike, sound alike drugs with their similar names, packaging are a major cause of medication errors, causing serious risk to patient safety. Today we have with us Dr. Parth Sharma. He is a community physician and a public health researcher with whom we will speak about the confusion caused by identical or deceptively similar brand names of the medicines and the dangers these drugs present, particularly in low income and middle income countries like India. Welcome, Dr. Parth. Welcome to South First.
Thanks, Sumit. Thanks for this opportunity.
Okay. So I'll start with very simple question, which I also was not much aware about earlier. What is look-alike, sound-alike, LASA medicine? Can you explain this to a lay people or a person who doesn't know much about the drugs, who might be hearing the term LASA for the first time?
So, like the name itself tells, look-alike, sound-alike drugs. So, these are drugs which have names or the way they look, either they look alike, the name of the drug, or the way the drug is packaged, or the name sounds alike. I'll give you one example. For
Hmm.
cancer, there is a drug called vincristine,
Okay.
and there's another drug called vinblastine.
Okay.
So, they both start with win, they
Hmm.
both end with INE.
Okay.
There was this game that we used to play even as kids that there'll be jumbled words in the paragraph and we can still be able to read the entire paragraph
Yes.
because the brain has the ability to find the right word just by looking at the starting letter and the end letter or
Yes.
the few combination of the starting and the. So this problem occurs in drugs also. When the starting letters are same, the ending letters are same, it's easy for a person to get confused. So
Hmm.
instead of win question, somebody might pick up win blasting.
Hmm.
So that's a look-alike problem.
Okay. Okay.
Sound-alike problem usually comes in certain drugs, which is now common in India because of the brand name. For example, Medzol.
Yes.
So there are many drugs, three drugs, which with the same name Medzol, which is the company name. Now, this is a problem because if doctors write only the brand name in their prescription and they don't write the name of what we call the salt in the prescription, then the pharmacist doesn't know what the doctor is actually prescribing.
Okay. Okay.
So that leads to another problem because then the pharmacist can give anything that they think or they have, which is called Medzol.
Hmm. Hmm, hmm.
So that's a big problem. The other thing is lookalike when the packaging is same.
Okay. Okay.
So it's possible that an antihypertensive drug and a drug for diabetes, they can look exactly the same.
Okay.
They'll be round, they'll be white, they'll come in a brown cover.
Hmm. Hmm,
Uh,
hmm.
the oil color will be brown on the packaging side. So that can lead to a look-alike problem for drugs when they are packaged like that. So if
Hmm.
somebody who is a diabetic person, but they can be dispensed a hypertensive medicine by mistake because they look similar. So somebody is not turning the medicine around and reading what the name is. That can lead to a problem because we know majority of a population is still semi-literate or illiterate. A
Hmm.
lot of our population can't still read in English. Most of them coming from rural India struggle reading those complicated medical terms. So
Okay.
if they are not reading the backside, usually that's how people identify that round tablet I'm having for diabetes, that long tablet is my cough tablet. Like so, that's how people identify their tablets in our country still. So
Yes.
that's the problem that look-alike drugs create.
Okay. So, that's my next question. How do similar looking drugs, particularly in terms of packaging and tablet appearance, impact patients' ability to correctly identify and use their medications, especially among the with low literacy levels people and also people from the rural background? How does it impact their health?
So one problem in our country is that the health system is quite overburdened when we talk about the public health system.
Hmm.
So in rural India, we know that public health system is for the poor, and that's where the poor people usually go.
Hmm.
Because private is so unaffordable. And because public health system then becomes so crowded, it's natural that at the pharmacy there'll be a crowd of people saying, "Give my medicine first to the pharmacist." They'll all be fighting because everybody is also very impatient when they're sick, which is
Yes.
natural.
Yes.
So
Yes.
then we'll give my tablet first, and so the pharmacist now, and we also know that our health system is quite understaffed. There is a
Hmm.
shortage of pharmacists, doctors. Everybody is short.
Hmm.
And so when the pharmacist is overburdened with work, with their 30, 40 people shouting at him to give their medicine first, it's possible that the pharmacist can give the wrong medicine because they look similar.
Okay.
So this has happened in one place where a person actually had hypertension,
Hmm.
which is a high blood pressure problem. The person was on telmisartan tablet,
Okay.
but because of that whole crowd rush and also the pharmacist was not very careful, the person received a drug called glimepiride. Now, glimepiride is a drug for diabetes.
Okay.
Telmisartan reduces your blood pressure, glimepiride reduces your blood sugar.
Okay.
So,
Okay.
if in a normal person we give a drug which reduces blood sugar, that can cause risk to life because suddenly their sugar will drop.
Hmm.
And if they are not aware, they won't understand why this is happening. So, because to a diabetic person, doctors explain that if your sugar drops, this will be the symptom. Take this, take sugar, take some toffee, chocolate if you feel like this. But somebody who does not have diabetes, it's very unlikely that they'll know how low sugar, what the low sugar symptoms are, or what they should do when they have these complaints. So that then for them becomes very risky.
Okay. So, who do you believe is the most responsible for creating this confusion? The doctors who prescribe the drugs, the pharmacist who dispenses them, the manufacturers who produces those medicines, or the regulatory authorities? Who is here the problem?
So I would say it's a very complex problem, and you can't point fingers at one particular person.
Okay. Okay.
There are ways to avoid this problem at each level. So the
Hmm.
first level is at the manufacturing level,
Hmm.
where there's something called tall man lettering, where
Hmm.
the words which differentiate two drug names, for
Hmm.
example, Vincristin and Vinblastin. So the Chris in Vincristin is different, and the blast is different. The rest all the letters are the same.
Hmm.
There's Win, there is in at the end, Chris in one, Blast in one. So these letters should be in capital while printing it on the
Hmm.
drug or the packaging of the drug, the box, so that whoever is seeing it becomes easier for them to differentiate.
Okay.
So this is one method at the manufacturing level which should be enforced. Regulatory authorities also have a role to play because then for them rules exist but they are not being implemented, they are not
Hmm.
being monitored, so then it becomes their job because there are laws in the country where trademark rules are there where two drugs cannot have the same name. They
Hmm.
have to go through a checking process before a brand name decides the name for their own drug. So there are a lot of laws, but then it becomes a responsibility of the regulatory authorities to make sure those laws are being implemented, and those who are not following those laws, they should be penalized.
Okay. So, in your
Similarly for doctors, yeah,
yeah, please continue.
I was saying similarly for doctors, there are again guidelines in place that doctors should only write generic names of drugs. So they should not write Calpol, they should write paracetamol.
Yes. Yes.
Because a lot of drugs can, like we have just I told, Medzol is a name which is not a drug name, it's a brand name, but similar brand name for many drugs.
Hmm.
So then it becomes the doctor's responsibility to only write generic names. If they think that one brand is better than the other and they feel that their patient deserves that better brand because there's a huge problem of substandard drugs also in the country, counterfeit drugs also in the country. So if a doctor has more confidence in one brand, then they can write the name of the generic name in brackets under it so that there is less confusion. And
Okay.
similarly, at the level of the pharmacist has to place similar looking drugs or similar sounding drugs in different shelves. So they know that they can't get mixed. So in our paper, which we published in the Lancet along with Murali Nilakanthan and Ashish Kulkarni, we have given these steps at each level of how this error can be avoided.
Okay. Okay. So, there is this question then, why the manufacturer, the drug manufacturer who produces these medicines, let's say that one manufacturer is producing hypertension, blood pressure medicine, and another producing diabetes, are putting the same name. Is there any benefit for them, or it is just the brand, the regulatory framework which has been created in our country, making them to brand the name of the drugs?
So there is some benefit also because usually the brand names become very famous.
Yes.
And so they try to sell their own drug using that famous brand name. For example, if you have a gastric problem, you know the first name that comes to mind is Pandy.
Yes.
If you have fever, the first name which comes to mind is Dolo.
Yes.
These brand names are famous.
Hmm.
So there is an attempt to piggyback on this famous brand name and sell their own drugs.
Okay.
But at the same time, it's also regulatory failure why these things are happening.
Okay. So at policy level, manufacturing, healthcare provider, and drug dispensing level, do you believe uh, what are the most urgent and mitigating issue right now is to regulate these LASA drugs? And, what can be done?
So in the current scenario where policy framework is not being implemented, where the implementation is very weak, I feel currently the only people who can act on this in the short interval are doctors and pharmacists.
Yes.
So it becomes the responsibility of doctors and pharmacists to make sure they're dispensing the right drug, they're writing generic names, they're explaining what drug is being prescribed to the patient, they're making sure that patients understand what drugs they're getting. So right now, I would say in the short term, it's the responsibility of us doctors and our pharmacists who are working with us. And in the long term, I would say the policy framework has to be strengthened. And the government has taken some steps in the recent past where they have said that certain drugs will have to be given in blue packets. There has to be a red line for Schedule H drugs. Schedule H drugs are drugs which cannot be bought without a prescription. Another app or software has also been made by the government to see if similar drug names exist. So the government has started to work on this, but this naturally will take time. This change will not come in a day. So till that change comes, I feel it becomes the responsibility of each pharmacist and each doctor to make sure that their patients are getting the right drugs and they understand what drugs they're getting.
And then I have this question that recently we have heard in the news and it was everywhere that Cedesco put out NSQ and spurious drugs list, and there were many common drugs, paracetamol as well as amoxicillin, and there were around 53 drugs which were found to be spurious and NSQ. So, and many of these drugs are quite common. It is used in our daily lives. People uses it. And also there was a case in Nagpur where talcum powder was also found in some drugs. So what do you see that when people are just buying these drugs and even our agencies are regulating it, how LASA can be regulated in this principle? And also one thing I really want to know from you, that in which category these drugs are mostly, like in which like if I have a fever, there are different paracetamols, Dolo or Carpol. These are the paracetamol, but we, as you mentioned, that we know by the name Dolo, so we just go to the counter and ask for a Dolo. So is there any particular category like in which these drugs are quite common?
So when we study pharmacology as students, medical students, there are different drug categories. For example, antibiotics are there.
Yes.
Under antibiotics, there are different types of antibiotics,
Yes.
fluoroquinolones, macrolides. So I like different type of antibiotics. The drugs which reduce our fever are called antipyretics. So these
Yes.
are drugs which reduce body temperature.
Mhm.
So that in that sense, there are different categories which we study for each drug. But the problem of LASA is very different from problem of substandard drugs and counterfeit drugs.
Okay.
These are not similar issue. A
Okay.
LASA drug is just two drugs which look same
Mhm.
and which sound same, but they can be of good quality. So
Okay.
LASA drugs only lead to medical error, which
Okay.
is wrong prescription, wrong dispensing.
Mm.
So that's the error LASA leads to.
Huh.
But substandard drugs and counterfeit drugs is a completely different issue where if a drug is supposed to have, say, paracetamol, if you buy 500 mg paracetamol,
Mhm.
but it has only 250 mg in it, actually, the active compound is only 250 mg, that is NSQ, not of
Okay.
standard quality.
Okay. Okay.
So, because it is not, the amount is not similar to what it should be there.
Okay.
Counterfeit drugs are, on the other hand, drugs which don't have active ingredient at all. So any, say, a cancer drug,
Mhm.
which is supposed to be a powder of, say, 200 mg, but it has only talcum powder in it. So that is counterfeit drugs which are produced under the name of a company,
Mm.
but it's fake. That company has actually not produced that drug. Somebody else has taken empty vials of that company, filled it with talcum powder, and they are reselling it.
Okay, so I have a question.
That's
Like, are these really a talcum powder? Like, I was reading somewhere on the social media. These are the talcum powder which are being used at home. Are those the talcum powder? Or it is of similar quality, or what is this talcum powder here?
So I mean, the news reports just say talcum powder. So it's
Yes.
possible it could just be that talcum powder which is being used at home.
Okay.
And over the this is not the first report which has come out like this. Previously, also from
Mhm.
Himachal Pradesh, UP, all these such counterfeit medicines have been busted by the police.
Okay.
So this is a huge problem in the country right now because for diabetes, hypertension medicine, one problem is that okay, disease is not being controlled. But when we talk about cancer drugs are very expensive.
Yes.
So if somebody is spending 8,000 rupees, the cheap ones in cancer are like 5,000, 8,000. The expensive ones can go in lakhs, 3 lakhs,
Mhm.
4 lakhs
Mhm.
for one vial. So there it becomes even a bigger problem because firstly that cancer is not getting the right treatment, and then people are losing out on their money also because these drugs are so expensive.
Okay. So, coming back to LASA, from a public health perspective, how important is to have a better regulation of drug names and packaging to avoid confusion? Is there need to have different names for each drug and packaging, or there should be any other regulation uh, which can say that okay, you can have same name, but you have to mention something else, or just say that like paracetamol just means like many of the street drug manufacturers, they just write paracetamol. That can also work in public domain because our health system is quite fragmented and it is overburdened, as you mentioned. So how these regulation can work and what should be there in the regulation? Can you mention that?
The first thing is that when deciding a name, there should not be any overlap.
Okay.
So that is the first part of the solution. The
Hmm.
second part is that while packaging, each category of drug could have a different kind of packaging. For example, if there is a drug, all the drugs which are given for diabetes could be
Hmm.
packaged in similar color boxes or similar color foil.
Hmm. Okay.
Even if the color of the tablet cannot be changed or the shape of the tablet cannot be changed, at least the packaging could be. If you see a packet with blue color foil, maybe it's diabetes. So that could be one solution. Similarly, for other category, all antibiotics could have a similar color foil.
Yes.
So that could be one solution. And the like you mentioned, problem for the public health system, it's a huge problem
Yes.
because uh, we know that in our country every year there is data to show that 5.5 crore people become poor because of healthcare expenditure.
Hmm.
And out of these, 3.8 crore become poor just because of expenditure on drugs. Now,
Okay.
if they are not getting the right drugs, even after spending so much, even after facing poverty, they'll further go down into poverty. Their disease will not be get controlled. Their productivity will go down. So this is a huge problem for our country because a population, if it's not productive and not healthy, the country can't advance further.
Okay.
So urgent regulatory mechanism is definitely need of the hour.
So, I have this final question to you that how do you foresee the future of healthcare evolving, minimize the risk posed by these LASA drugs? Do you think technological solutions such as digital prescription could offer a viable pathway uh, forward?
No, definitely digital. The whole hospital information management system is definitely one of major solutions which can stop this LASA problem
Okay.
because it'll be the doctor clicking on the system
Hmm.
and the prescription from there going to the pharmacist digitally. So there is no issue of handwriting being a problem in which drugs are misread. When the doctor is clicking on the system, the pharmacist will know both the brand name and the generic name of the drug. So that reduces a lot of problems, even though some errors might still occur because of packaging issues
Hmm.
and dispensing issues.
Okay.
But the digital solutions definitely do exist. And
Good.
even if there are some digital screening methods for companies before they decide the brand name,
Hmm.
that also could help.
Okay.
So the Digital India movement, which is even the Ayushman Bharat digital mission, which is trying to create hospital information management systems across the country, that will definitely help in addressing this issue.
Okay. Thank you. Thank you, Dr. Parth. Thank you for speaking to South.